All right, good afternoon, everyone. I think we can start our webinar. Although we received more than 50 confirmed to this webinar, and now we have only 17 out of the confirmed participants. So we can start our webinar right now, right? Is it okay? Okay. All right, so first of all, I would like to introduce myself. My name is Sương Sarun, the Executive Director of the Cooperation Committee for Cambodia, CCC, and also representing the Asia Development Alliance to sit as the steering committee members of Asia Democracy Network. Today it's my honors and pleasures, and thanks to ADN, especially Ichel and Sue, for having me to be as a moderator for this one of a series webinar on the democracy, especially the issue related to COVID-19. So you may have received the invitation with clear agenda for today. We will start from 1 p.m. Cambodian or Thailand time, and then we will end the session by 2:45. So our duration of our webinar will take you through around 1 hour 45 minutes. But we start a little bit late, I can say, but we can keep our webinar within this allocated time. So before I introduce to you on the moderator and this and that, but let me start with you the aims of our series of webinars. The aims of our webinar is to gather the diverse as well as the inclusive ASEAN narratives on how COVID-19 impact to civil society and other stakeholders in Asia, and especially for today, a webinar is talking about how the success from different countries in Asia in tackling the pandemic COVID-19. So we will learn from our guest speakers. We have very privileged three guest speakers on board with us. First, we have Ms. Let me look at my notes here. We have Ms. Lee Hee-Yong-Chi, Deputy Director from the Ministries of Economy and Finance, Republic of Korea. Welcome on board, Ms. Hee-Yong-Chi. The second, we have Ms. Yawei, the Program Officer from Taiwan's Foundation for Democracies, Taiwan Foundation for Democracy. And the third one, we have Kingsley Abbott, the Senior Legal Advisor from the Global Readiness and Accountabilities. We have also our discussion, Dr. Kostov from Priya, India. So I will read in detail on their profile, but because of the time for now, I would like to invite Ms. Sue to provide the welcome and opening remark for this webinar. Sue, please.
Thank you, Sarwin. Hello, everybody. Thank you for making time to attend this webinar. I'm the program manager. My name is Sue. I'm the program manager at the Asian Democracy Network. And I want to kind of explain to you what Asian Democracy Network is. It's a regional network. It's a network of network. We have members across the region that are networks like Forum Asia, Migrants, Foreign in Asia, ANFRA, which is the Asian Network for Elections. So we cover a diverse range of thematics that falls under the large umbrella of democracy. And what we do is work on programs and advocacy to strengthen solidarity and promote and defend democracy across Asia. And I think one of our main purposes is really to highlight the Asian narrative of democracy and how do we do that, make that into mainstream so that we promote democracy more widely in the region. And this is precisely why we've been launching the Democracy Chronicles webinar series. With the whole COVID-19 pandemic, we saw that there was a lack of, there were a lot of voices that were being left behind during the COVID-19 pandemic, and wanted to create a program where we could highlight those voices and make sure that those voices come up to the mainstream, which is why we started this webinar, and we thank you for taking time to participate. And also just wanted to give a little bit of an admin for all of you who are attending. If you have any questions for any of the speakers, on your screen, there should be a section where you could post your questions. If you could go ahead and do that, we'll go ahead and highlight those questions and pose it to the speakers for them to answer. Great, thank you. And I'll hand it back to Zarwin.
Thank you so much, Sue, for your very insightful welcomes and also opening the session of our webinar. So now we move to the next agenda. It's about the presentation of the speakers. But let me introduce our speakers again. First, we have Ms. Lee Hee-Yong-Chi, the Deputy Director from the Ministries of Economy and Finance, the Republic of Korea. And I hope she will also introduce herself in detail when she make her presentations. And then the second speakers, we have Ms. Yawei. She's a Program Officer from Taiwan Foundation for Democracy. She is the organizer of the Taiwan TFD for Democracies, Asia Young Leaders for Democracy programs. and the East Asia Democracy Forums. As the program officer at the Domestic Affairs Departments of the TFD, she also has been striving to connecting Taiwan's NGOs with international civil society and also working closely with NGO advocating for media literacy, LGBTQI rights, women's rights, participatory and deliberatory democracies, and also youth participations. She holds a master's degree in the international relations from the Departments of Political Science of the National Taiwan Universities. Please welcome her on board.
Thank you.
The third speaker, we have gender balance on our panelists, Mr. Kingsley Abbott. Welcome on board. He's the senior legal advisor from the Global Readiness and Accountabilities. He joined the International Commission of Jurists in January 2014, and normally he resides in Thailand, but he temporarily returned to his home country, New Zealand, because maybe it's of COVID-19. So this is the things that he can share with you on how he can cope with this outbreaks of COVID-19 and its impacts. So he also leads the International Commission of Jurists work on accountabilities for serious human rights violations. In the past, he worked for the United Nations as the senior legal officers at Khmer Rouge Tribunal in Cambodia. Luckily, we haven't met before, so now we met Kingsley. So I invite you to come back Cambodia again, so we can see each other here. And also, he used to be a trial counsel in the Office of the Prosecutors at the Special Tribunal in Lebanon, in The Hague. He also practices as the criminal barristers in New Zealand. So please join us, welcome him. And after the three speakers, we have our discussion. Dr. Kostov. Kostov is currently the director of Priya, India, and he has more than 2 decades of professional experience with the university, research institution, and civil society organization. He has led and managed a number of national and international research and action learning initiatives in many ASEAN countries on the citizen participation, social accountability. Yes, I used to learn from you, Gustav, one of your students. And also civil society development and democratic governance in urban and rural contexts. Currently, he is the global coordinator of LogoLink and also serves as the steering committee of Asia Democracy Network. And he is associated with the Global Partnership for on Social Accountability, GPSA. I think this is under the World Bank initiative. And also the Local Governance Initiative, LOCIN. And also International Cooperation Policy Research Network. There are many things I need to skip a few. So, and then he graduated as a PhD degree in anthropology. So, please, Sonia, welcome our 3 speakers and our discussion. So, let me, Ms. Yahweh. She's a program officer from Taiwan Foundation for Democracy. So the floor is yours.
Hey, thank you. Okay, I'm Yahweh Chao from the Taiwan Foundation for Democracy, and now I begin my presentation with my PowerPoint. Hey, so I believe that you will already search a lot of international media. There's a report about how Taiwan and South Korea and New Zealand, how they combat COVID-19, especially regarding the aspects of the what policy or technology tools they use to combat COVID-19. So my presentation will not focus on those aspects because I assume you can already find a lot of them from just Google. My presentation will focus on how democracy and freedom help Taiwan to combat COVID-19, especially just like what Sue has said at the beginning of this webinar, that we need to discover how democracy can really help a country to survive the crisis, and there's a lot of government or politicians using urgent order, namely to combat to combat COVID-19. However, they're actually doing power grab. So it's really important to rethink how democracy and freedom can help a country to survive under a crisis such as COVID-19. So before I start the presentation, let me give you some quick facts about Taiwan's action against COVID-19. Until yesterday, according to the numbers from CDC, there's are 7 deaths and no local infected cases for more than 35 days in Taiwan, no imported infected cases for more than 10 days, and there's total 440 infected cases. This is not easy because the geographic distance between Taiwan and China is only around 180 kilometers. And now kids are still go to schools and baseball games are still held. And Taiwan has already donated at least 10 million masks to help countries around the world. So from the international media coverage, what you will see about Taiwan model will be regarding we take early actions and effective border control and our efficient and sufficient mass supply system and technology we use. However, I personally think that without Taiwan's democratic system and freedom and the citizens' awareness, those technology and policy might not be this useful. And our civil society has already started to connecting with global civil society to help each other, especially fact-check NGOs, to fight against disinformation regarding COVID-19, and our civic tech communities has already been helping out. And from my personal opinion, there's 4 points of how democracy and freedom already helped Taiwan to combat COVID-19. The first is the freedom of speech and the internet we have, and the people's awareness of taking actions, of protecting the country, and the awareness is accumulative from many social movements. And the third aspect is there's a good cooperation between the government and the people. And finally, there's a kind of professionalism that is complementary to democracy and human rights during the process of fighting against COVID-19. So the first point is the freedom of speech and the free environment of our internet really help us to take early actions. There's a very clear example. In on 2019, December 31st, it was 3 a.m. There's a CDC, our Central Disease Control Center officer. He was just hanging around on PTT. It was a online platform which is one of the most popular platform in Taiwan, sort of like a Reddit in the States. So he was like browsing the website, and suddenly he found there's a post. It was a screenshot of a social media chatting records, and it was in simplified Chinese. It says that there's already some unusual pneumonia cases in China occurred. And so, okay, so the officer immediately reported the case to his superior, and that is how our CDC can take really actions already in 2019. But think about what will happen if this kind of post occurred in authoritarian country. The whistleblower might be already caught by the government, might be silenced by the government, and also the freedom of the internet also helps our civic CSO to quickly fact check fake news and start their cross-country collaboration to fact check those information regarding the spread of COVID-19 in Taiwan. And the second point is after many key social movements that pushed for Taiwan's democratization, those movements have cultivated a very self-motivated citizens who are willing to take actions to bring difference. And after they take actions, it was proved that the people can really make difference. So especially the civic tech community called GovZero in Taiwan, they really contribute a lot in the process of fighting against COVID-19. So much international reports about how Taiwan combat COVID-19. It all gives positive comments about Taiwan's mask supply policy. But actually, in the beginning, in January, it actually received much criticism because when people went to the convenience store, they found there's no mask supply already. So seeing this problem, at least 26 technology professionals who is the volunteer of the GovZero community, they voluntarily established an online real-time mask supply map, which allows netizens you can update the number of stock of masks in convenience stores, and users can also see how many masks left in the convenience store around where they live. So after the establishment of the map, our digital minister, Audrey Tan, who is also one of the contributor of the GovZero community before she became the minister, she immediately contact those founders of the online map and contact them and coordinate their works with our government. So that is how we gradually optimize Taiwan's mask supply policy. And now everyone can have at least 9 masks for 2 weeks, and you can even order that online. And the GovZero community, they already host a hackathon, share their experience with the civic tech community in Korea and Japan. So they actually made the process into a PowerPoint on YouTube, so you can search it online, although it was in Chinese. So following the case of how the government and the civil society collaborate on the mask supply policy, that's my third point that I want to emphasize is there's a good collaboration between civil society and the government. The first is our Central Disease Control Center. They held a 1-hour press conference every day at 2 p.m. So the media can ask whatever they want to ask, and people can receive transparent information from the government, so they will not feel panic. And also, take the mass supply policy as example. Many international media give positive comments about the policy of Taiwanese government, but I really think that we should focus on how Taiwanese government can adjust and fix their policy very quickly every time when the people giving criticism, feedback, or opinions, and they even bring people's idea into their policy, so make the policy become more comprehensive. And especially we're facing this kind of unpredictable virus, we need democracy very much because we need the people to contribute their idea, their feedback to sustain the government's resilience and flexibility to combat this kind of virus. And my final point is there's a very good professionalism complementary to democracy and human rights in Taiwan. So many countries in the world, they already use emergent legal measures to announce this country will be enter into the emergent status namely for combating COVID-19. But we all know that that will limit people's freedom and undermine democracy very much. But Taiwanese government, until now, we haven't used the kind of emergent order, and we're really cautious and self-control. And I think the professional team of the Central Disease Center, they really did a lot of help because they can offer the government professional and scientific analysis, and they can calmly evaluate the current status of outbreak. And thus we can list how many usable technological and policy tools we can use instead of easily just going to the option for issuing emergent order. And also our Central Disease Control Center, they also use their professional as pandemic control professionals. Um, they continuously urge people not to tracking or doxing people suspected of infecting coronavirus or tracking those people are in quarantine because fears and discrimination against these people will just make it harder to find the real source of infections. And what is more important is to establish a comprehensive safety net for those people and with the collaborations with local communities and hospitals and social welfare sectors so that can keep to make them feel safe, and people who are really being infected will be willing to go to hospital for treatment without fear, and people in quarantine can calmly finish their quarantine duration. So those 4 points are what I want to share, that how democracy and freedom can really help the country get through the difficulties. Thanks you for your listening.
Thank you so much, Ms. Yahweh, for your very comprehensive presentation and really highlight 4 points. And I think this is very, very helpful for us to understand how Taiwan government and civil society and also Taiwanese work together to combat COVID-19 by using democracies and freedoms of expression or participations. So we have one more guest speakers. Now you hear already 2 female speakers. We move to our male speakers. Kingsley Abbott. He will guide you through his best practices by moving from Thailand to New Zealand during the COVID outbreak and impact. So share us your success story. Albert, time's you.
Thank you very much, and a big thank you to ADN and Sue and the channel for inviting me to be part of the panel. First of all, I want to clarify that I'm not a member of the New Zealand government. I'm a New Zealander who's lived and worked in Asia for more than 10 years now, usually based in Bangkok. But I was one of those people who returned to New Zealand when the crisis started to get worse. I was lucky to find a flight home where I'm now here with my family. And I work for an international organization called the International Commission of Jurists, which has legal advisors all over the world. And a lot of our work recently has been on a response to COVID-19 grounded in human rights and the rule of law. So if you visit our website, icj.org, you will see a lot of information around the international law and standards that states should be complying with in their response to COVID-19. I'll talk a little bit about New Zealand briefly because New Zealand has been in the news internationally because we have been quite successful in combating COVID-19, and we have also at the moment a Prime Minister who has a reputation for her strong and empathetic leadership. New Zealand has so far had about one. Yes.
I'm sorry, you're very muffled. We can't really hear you.
Is that a little bit better?
Oh yes, perfect.
Oh, maybe my computer was just a bit far away. Sorry.
Yeah.
So New Zealand so far has had 1,153 confirmed cases of COVID-19. 21 people have passed away. There are currently 40 active cases and 2 people who are in hospital as of today. There haven't been many new cases now for several days. A very large percentage of New Zealand's cases have been linked to overseas arrivals. And New Zealand has done a good job in addressing the crisis. And according to a recent survey, the government is very popular right now. But New Zealand has some advantages in all of this. One is that we have a population of only 5 million people. We are a small island in the very bottom of the world in the South Pacific, so it's easy to control our borders. And the country, I think, importantly, has quite a strong track record on human rights, the rule of law, and democracy. And at the moment, like I said, we are experiencing some particularly strong leadership by our Prime Minister, Jacinda Ardern. You know, this is my personal view, but I believe she has a particular talent for clear communication and empathetic leadership. And the response of the government to COVID-19 has largely complied with international law and standards, although some issues are debatable and under consideration. Some issues are before the courts at the moment. But the fact that I think the response has largely been grounded in human rights and democracy and the rule of law is very much contributed to New Zealand's ability to combat the virus, because the government's response has received a lot of public support, and the restrictive measures that were put in place were largely complied with because people felt that the government was taking a scientific approach, an evidence-based approach. They were concerned about restrictions on human rights. And I think importantly, the government has been quite transparent and good at communicating. So I'll just quickly focus on 5 features worth highlighting with respect to New Zealand's response. And again, I want to emphasize I'm not a member of the New Zealand government myself, but I have been watching closely as the New Zealander sitting here and experiencing firsthand the government's work. I think the first feature I would highlight is that there has been excellent communication and transparency between the government and the people of New Zealand. There's an excellent website that was created very quickly, detailing everything you need to know about the government's response to COVID-19. And I checked today and I see that it is now available in 28 different languages, including Thai and simplified Chinese, and a real effort has been made to ensure that all the different people who live in New Zealand are able to access the same information. There's also a lot of information about the virus, what measures people should take in order to protect their health. There have been daily briefings with the Prime Minister and the Director General of Health at 1 o'clock every weekday. There's like constant notifications on the TV and the radio. And interestingly, in the evenings, the Prime Minister, Jacinda Ardern, would often give more personal Facebook briefings from her house, just to say, I hope everybody's doing okay. And this kind of thing, I think, has really made New Zealanders feel a sense of solidarity with each other, even though restrictions on us were very tight for a long time. And there's been a very good use of simplified messaging, around staying home, save lives, these kinds of things. The second thing I think that has been successful is that the government has implemented a quite easy to understand 4-level alert system. And so, at the moment we are at level 2. Previously we were at level 4 and level 3, and each level that the government says that we are at dictates what we can and cannot do and the various restrictions that are in place. So now currently under level 2, the government considers that the disease has been contained. This just came into force last week, and it means that for the most part shops are open, people are able to travel around New Zealand, have contact outside of their family bubbles, but everyone still has to be careful and keep a record of where they're going, who they had contact with, and so on. I think another thing that's been quite successful is that for the most part, the very tight restrictions on human rights, including the right to free movement, the right to free association, these restrictions have been for the most part necessary and proportionate as required under international human rights law and standards. And the restrictions are for the most part grounded in the law, using New Zealand's Health Act, the Civil Defence Emergency Act, and new legislation has just been passed, each detailing what powers the government and the executive have and don't have. So there's a legal basis. The response has, you can go to the law and say that is why the situation is like this. This is why the police suddenly can do that. But of course, I say largely because there are challenges to some of this in the New Zealand courts, and concerns have been raised, particularly about the new legislation that's just been passed. The other thing I think that has been quite successful is that the government didn't just put restrictions in place. It acknowledged that there were going to be a lot of people adversely affected by the restrictions, including people who were at the lower socioeconomic level, Maori people and our indigenous people. And so they have put in place a number of financial support mechanisms, helping people with money, helping people with redundancy, making it unlawful for landlords to throw their tenants out or to raise rents at the moment. If people need to have a holiday from their bank loans or mortgage repayments, they can go to the bank. And there's some specific advice and support for Maori people, the Maori community, and people who may be victims of sexual and gender-based violence and domestic violence at home. If you go to the government's website, there's a very long list of services that are available for people who might be victims of domestic violence. The last thing I will highlight in terms of the government's response, I think that has been good, is the establishment of an oversight committee. When New Zealand declared that we were at level 4 and Parliament was suddenly no longer sitting, so there wasn't the usual debate and checks and balances in the Parliament about what steps the government was taking, they established a special committee, a select committee, that was headed by the leader of the opposition and representatives of all the different political parties, which has the power to request information, to summon people to give evidence, to give testimony, legal experts, scientific experts, and it essentially is there to provide independent scrutiny of the government's actions, and to advise as to what steps the government should or shouldn't take. It cannot order the government to do anything, but its recommendations have some weight. It means that there are some checks and balances. I'll just finish by highlighting a few issues where people have put up their hand and said, this raises concern. The response hasn't been perfect. One is that there has been sometimes a lack of clarity, particularly in the early days of the restrictions, about what powers do the police have exactly. When the government says I can only exercise locally, what does locally mean? Am I allowed to go to the beach or not? What does essential travel mean? And there was it was reported that there was allegedly an opinion from the government lawyers that some of the police powers didn't have a basis in the law, actually. There is now some new legislation that has been passed that allows for the police to enter private dwellings without a warrant, without judicial oversight. And that was originally in there for a period of 2 years, but there's been a lot of scrutiny of that. The Chief Human Rights Commissioner said that he was very concerned about it. There was no time for public input into that law. And so now it's been ordered to go back to a special committee that will review it and advise. And that law will be reviewed every 90 days, which is important because under international human rights law and standards, any restrictions on human rights should be subject to review, and they should have a time limit on them. The last issue before I finish is that there have been some issues around the way in which people are tracking their movements. There have been talk of using apps to on your phone an app to say, okay, today you went to this area, you had contact with these people. Some businesses are already using their own apps. Some local, I think, regions are using apps. But interestingly, tomorrow, the government will launch an official app that everybody can download. And I think what's interesting and important about it is that it doesn't collect information about you that the government can access, which might raise some human rights privacy concerns. It just allows you to keep what they call a diary, so that you keep your own record of where you've been, who you've spoken to. So if you then end up having symptoms of COVID-19, you have your own record that you can share with the government. So you keep the information, not the government. So, just to finish, I think a large part of the success of New Zealand in combating this virus has been really because there's been a lot of public support for the restrictive measures that were put in place. And that is because, the government really did a good job on communicating, ensuring that there was some oversight or some scrutiny, the measures it was taking, and that its actions were based on science and evidence, and for the most part were human rights compliant, and there was some accountability and transparency in terms of its response. Thank you.
Thanks so much, Kingsley Abbott, for sharing success story in New Zealand, as well as you also highlight some key issues also happening within New Zealand. You really touch, including demographically as well as geographically, New Zealand is a very good place, and also very good track records on human rights and democracies. I can say it's one of the top ranks in the world. So participants and speakers, we now have learned from our three speakers, sharing their best practices or experience at both policies as well as implementation levels or practice levels. And present our agenda, we have one discussant, Dr. Costo. He will make some reflections on the three speakers. So, Costo, the floor is yours.
Thank you, Sarun. It was wonderful to hear these three brilliant presentations. I think they were really insightful, and a lot has been covered in all these three presentations. I think there is also a kind of remarkable similarities between these three presentations and what we have been experiencing in India. But perhaps, one thing that came to my mind is to look at the peculiarities in each of these countries from a positive point of view, as they are. Look at Taiwan's population. It's like 23 million. South Korean population would be roughly 51 million. And Mr. Abbott has mentioned that New Zealand's population is 5 million. So I think a lot depends on how the governments respond to this pandemic and the disaster on the population side, not only the population size, but also the density of the population and how do you manage the localities. And certain localities are obviously much more dense as compared to others. But also the per capita resource base and the quality of governance, and which in a way impact the quality of life. So you cannot really expect during the time of disaster and pandemic, suddenly the governments will respond in a better manner if the governance institutions, the democratic practices, and the agility of these institutions and the capacities of these institutions are not in place. So you would expect then miracles, but miracles do happen. So I guess that most of the governments have been trying their best to respond to this. I was quite sort of impressed with the presentation from South Korea, and the focus on this what you called, Mr. Lee, Miss Lee, 3T and P, um, testing, tracing, and treating, and with participation. And I see that P has a deep connections with what we heard from Taiwan, where Ms. Chow said that the freedom of speech and the internet freedom have really helped, and I think it was supported by Mr. Abbott as well. The communication and transparency between the government and the citizens. So I think there are very good lessons coming out from these three presentations. But let me reflect on a couple of things that I see in India today. As of today, we have over 100,000 infected patients. The good news is that almost like 35,000 have been recovered, and there have been death of 3,200 patients. Now, but if you look at the rate of infections, and if you compare these with some of the other countries, so in India, it's basically 1.3 persons per million. That's the infection rate. But if you compare this with the US, it will be something around 226 persons per million. And if you compare it with the UK, it will be around 450 per million. So from that point of view, I'd say that this is remarkable from the point of view of public health management. Of course, one can challenge this figure because in India, there is kind of lack of adequate testing, particularly for the asymptomatic cases. And here is one area where government has to do quite a lot. Now we are under the lockdown 4 phase, and the first phase started from 25th of March. Um, I think government of India has done the right thing at the it was a right call in terms of imposing the lockdown. Um, Particularly if you look at the public health system and the infrastructure available and the government's ability to respond to a huge number of population. We are a country of 1.3 billion. Of course, some of the research groups suggest that, this is one of the harshest lockdown measures in the world. And it had its implication, and it is going to be affecting a lot of people, particularly the poor and marginalized. The other thing that the government has done was the zoning of districts and municipalities with some categorization like red, orange, and green, and depending on the occurrence of infections, and to reinforce the social distancing norms. The third thing that the government has done is also, emulating the experience from South Korea and Singapore. It has launched a GPS-based technology. It's in local language. It's called Arogya Setu. It's basically bridging the recovery. That could be the appropriate or nearest English translation. So it traces the infected person, and tells you, once you download the app, it tells you where they are located and how far you are from the infection. So that's definitely going to help. But there is also a concern from the human rights groups and people at large, because the kind of information that is stored and asked for in order to activate this app, and there is no policy as such, in India, that what are they going to do with this information. It's only last week they clarified that this information will be stored for 180 days and then will be completely deleted. But nobody knows where is the server, where the data travels to, so on and so forth. There's a bit of a lack of transparency there on part of the government. I think Ms. Chow has mentioned about the international cooperation. I would say that government of India has been generous to contribute to almost like 10 million US dollar to SARC COVID fund, which can be used by any country, but including the donor country. Um, uh, it's only in the towards the end of the phase one, government announced some economic packages. The initial package that was announced uh, primarily for the poor and marginalized and informal workers, it was roughly 49 billion US dollar, and it largely included free supply of food, and the cash transfer to the farmers, to widows, single women, elderly people, and those who are sort of marginalized and vulnerable within the society. I think that was a good call. But what has happened that, and as it sort of in a way support what I started by saying, that if your institutions are not agile, your institutions are not capable, the procedures are cumbersome, then accessing those resources becomes a problem. So what happened that the we have a massive public distribution system which offers subsidized food to the poor and vulnerable. But the unfortunate thing is that those cardholders, they are linked to their native place, their birthplace, or the where their domicile. Now, if those workers travel to other cities, they will not be able to draw those subsidized food from those subsidized shops. So what is of use then? We have been talking about the increase the portability of these cards, but so far it's only 2 days back the minister has announced that they will introduce a law by which they will increase the portability of the or validity of these the cards. And last week also, they have allocated. Government has announced another financial package. Roughly, it will be 400 billion US dollar, primarily for the alleviation of informal workers, to inject some liquidity to MSME, and of course, they have introduced a range of reforms. But if you look closely to what is being claimed as reforms, one would doubt, because in at least in 3 states, the labor laws have been completely relaxed for the next 3 years. Hire and fire rules have been introduced quite liberally. So these labor reforms have been introduced at a time when the informal workers are at a great distress. So that's the kind of question that many people are asking, civil society groups, academicians, and the observers are commenting upon. Now, what surprised the government and government across 3 layers, the union government, the state government, and the local government, is the massive exodus of migrant laborers. Now, the problem is that nobody in India really doesn't really knows that how many informal workers are there. So there's a kind of rough estimate that there are 8 million informal workers, and of which almost like 1 million had decided to go back to their villages. Now, with the public transport completely stopped, there is no way they can go back to their villages. So what they started doing is walking almost like 1,000 kilometers from Mumbai to their villages, from Surat, from Ahmedabad, from Chennai, from Calcutta, all the state capitals and the industrial centers, where these informal workers were working with different kinds of informal industries, ancillary industries. Because of this desperation, they have started walking back to them. and literally they are on the street, and the management is, I won't say it is management at all. It's a total chaos. And the conditions of these informal workers abysmal. They are not getting food, they are not getting water. Some of them are traveling with their spouse and children. So it's really a human disaster. And that partly happened because of the inability to anticipate this kind of thing, but also a kind of lack of communication between these groups and the government. Nobody gave them assurance that the government is going to make some cash transfer, they are going to liberally distribute food, so on and so forth. So it's a kind of desperation. And if the objective of the lockdown and all kinds of measure was to reduce the death rate, but you might be successful in arresting the death rates due to COVID-19 infection, but we are ending up in a situation where people are dying out of starvation. So there is a kind of deep question that has it served the purpose? The most harshest lockdown, has it served the purpose? So in this scenario, perhaps, one of the best practices is evolving from the citizens association and civil society. They have been doing remarkable work. We just did a survey in the month of April, and in the middle of May we came out with the report, and it was amazing to see that how citizen associations and civil society groups are supporting these affected communities by distributing food, water, medicines, personal protective equipments, disseminating information, accessing information from the government portals here and there, from the international sources, particularly from the WHO, and norms of social distancing, other protective measures. All these informations are being disseminated by the civil society groups. They are also helping the informal workers, both in the rural areas, the agricultural workers, and in the urban areas, the other informal, those who are associated with the industries or service sectors, helping them to access government schemes and program benefits. In a way, sort of holding the local governance institutions, the local institutions accountable. A lot of civil society organizations are also collecting information from the ground, the gaps in service provisioning, or the kind of information related to infection, and those informations are now being shared with the government for actions. Most of the time, the well-meaning officials are welcoming this information and acknowledging that gaps, but as I said, that when there is a kind of inherent democratic deficits in the local system, then you doubt any information coming from outside, which is not within the system. So therefore, the mistrust between the civil society groups and the local administration, or for that matter, which is sort of in a way reinforced by the national government and the state governments in some cases, is creating a barrier. So I would sort of it's a kind of 50-50, half glass full, half glass empty situation in India, where government has taken many measures, but because of the weak institutions, they are not being able to deliver those. But on the other hand, we see a ray of hope the way civil society and citizens associations are coming up and supporting the the affected communities. So let me stop here, and with more questions we can sort of interact. Thank you, Sarun, and thank you all.
Yeah. Right. Thank you so much. I think it's time for a question from our participant. I don't need to recap of this presentation from our three presenters and also from our discussions, but I would like to invite our participant to raise your question or even share your comments or best practices from you.
Okay, so there were some questions posed on the site, so I'll read out one of the questions, and everyone else who's still listening in, please post your questions.
Do we have more questions?
I have a question. Yao Wei, I wanted to.
Sue, right?
Yes, sorry. I was
Yes,
kind
I
of curious.
forget to yeah. Sorry, I forget. If, for those who wish to ask a question, please introduce yourself, right? And to which guest speaker, which guest speaker you wish to ask. Okay.
Great. So this is Sue from ADN, and I had a question for Yahweh. So I know Taiwan had there were several very creative innovation technology that was used. Are you able to kind of explain that a little bit more in specific? What were some of those innovative technology that was used and was presented by the Minister of, yes, you know who I'm talking about, right? Yeah. Oh, hold on, you're on mute.
Yeah. Please unmute yourself, Oye.
Hello. Hello, can you guys
Yes, we
hear
hear
me?
you, please.
Okay, cool.
Yep.
One of the example is just like the civic tech community I just mentioned. They voluntarily establish a lot of open source and voluntary technological tools that allows everybody can participate, but also in the government, in our executive yuan. It's just like the center of our executive branch. They have a coordination committee of how to integrate all kinds of technology for pandemic prevention, and they organized the committee at the very beginning of the pandemic. So the first, I remember, as I know, they start discuss how to use AI to track the current cases of coronavirus and what kinds of medicines have that the international community already tried. And they try to use AI to analyze the big data to find what kinds of medicines can be the most efficient and valid medicines that communicate and communicate with all kinds of academic institutions. And also they're also helping to integrate the information of the people of their travel history. So when you in Taiwan, everybody has a public insurance card. So every time you go to the hospital to do your clinic, then you have to bring your public insurance card and inject into the computer of the clinic. And the clinic will know the histories of your what kind of medicine you have taken. And at this time, we use that for people to buy their mask in drugstores. The government successfully integrates the systems into the public insurance card system. And every time they went to the drugstore to buy pharmacy to buy their mask, there will be records to show whether this person has already purchased the mask. So the government and the profession staff in the drugstore will know that whether this person already purchased the mask. So that's to ensure that the country will have enough mask supply. And also, if you go to the clinic, the doctor using the insurance card, public insurance card, they can know whether you have traveled to the area who is serious infected of COVID-19. So the doctor can have very scientific evaluations about your body conditions. and suggest you to take correct measures. And also, we speed up the steps for checking for border control. So if you are on the airplane back to Taiwan, you don't have to like write those information on the forms that the attendants give you on the airplane. You just need to scan the QR code, then there will be a questionnaire on your cell phone. Then you can enter your personal information on the QR code, and also includes where you have been travel, whether you have syndromes like a flu or pneumonia. However, our government has very cautiously keep this data. They work very hard to make it anonymous. Besides very urgent necessity, they will not use this data for something else other than prevention of disease. So that's what I know currently. Yeah.
Great, thank you. So we have more questions.
Do
I'll
you
go
have
ahead.
more?
Yes, more people have posted questions. I'll go ahead and read them off here. So I have a question from Miss Abdi Srian Gati from also Indonesia, and she had a question for all three countries, South Korea, Taiwan, and New Zealand. She wanted to know, is there any specific policies in regards to migrant workers? If yes, what are the main content? I guess she asked this because several countries already sent back a lot of Indonesian migrant workers, and perhaps that this also has something to do with the policy in other countries. And she wanted to know a little bit about that, especially when a significant amount of migrant workers from Indonesia are in three of these countries. I have more questions. We have Mr. Awif Harochi from Japan. He asks, specifically for Korea, it seems like the economic stimulation measure seems only for credit card and debit card holders. What about those who do not have access to these? And one last question is specifically on, I don't think any of the participants will be able to answer this, but I'll just highlight this here. Kongyos Bunrak asked he would like, or she would like to know about the elections that was held recently in the Republic of Korea. I don't think we'll be able to get to that question because that's needs to be, we'll be having a separate webinar on that, so we'll hold that for now. Okay, great, I'll give it back to the speakers.
So
Thank you so
okay.
much, speakers and the speaker.
Okay, our reply to the questions about how we protect migrant workers during the pandemic. There's 2 points. The one is at the beginning, when the government start to publish some principle or instructions of how to protect yourself regarding against COVID-19, such as pamphlets or TV commercial or Facebook posts. Well, a lot of people, especially the migrant workers or NGO, they start to remind the government that there is no languages that migrant workers can understand. Because in Taiwan, there's a lot of migrant workers from the Philippines, from Thailand, from Indonesia, from Vietnam. So from then on, that the central government and the local government start to make a lot of instructions, handbook, pamphlets in languages such as including Indonesia, Tagalog, and Thai. And now, if you live in Taiwan, when you turn on the TV, I think at least every 2 or 3 hours, you will saw there's a lot of versions of the TV commercial that showing that how we protect yourself against COVID-19. And now you can see there's the commercial is in Indonesia. I saw that one twice last week. One is in Indonesia, another one is in Tagalog, and some of them are in the languages of indigenous people. And the second part is there's actually one infected case, which is the person is actually a illegal migrant workers. So that makes a huge discussions in Taiwan society. Of course, some people will start to think about whether we should deport all the illegal migrant workers in Taiwan. However, there's also people saying that no, we shouldn't do that because those migrant workers, they are also taking care of our families, especially for some people. The reason why they choose to hire illegal migrant workers is because they don't have the enough money to pay the reasonable salary to hire migrant workers at hit the level of salaries of the government, what government has ruled. So our central DC control head, he made a really right choice. He said that in a press conference saying that he will not going to make the decision of deport all the illegal migrant workers, especially during this time, because there are a lot of people such as elderly or people with long-term disease. They are the most vulnerable people of the COVID-19. And if you deport all the illegal migrant workers who was taking care of them, those people will be exposed to higher risk of the pandemic. So the government make the decision, they are not going to very actively check or deport all the illegal migrant worker during the pandemic. However, the government also held a press conference, encourage those illegal migrant workers, if you voluntarily come to the government sector to report yourself, then first you will receive proper treatment if you feel you have kind of syndromes similar to COVID-19. The second, you will not get fined, and the government will instruct you to follow the proper procedure to make it meet the regulations of Taiwan. So that's the two examples that currently I saw of how Taiwanese government and society treat the to protect migrant workers under COVID-19.
Thank you. Albert, do you have any things to add?
I wanted to say, first of all, I'm not an expert on the situation of migrants in New Zealand, but coincidentally, it's actually been a big issue in the news just recently. There were some government documents that were made public, which stated that they thought there were about 380,000 migrant workers, loosely described, in New Zealand, and about 41,000 people who hold work permits. Now, some of those, or many of those people, have been affected by the economic downturn. They've lost jobs, and under New Zealand laws, they don't have automatic access to social security or unemployment benefits in New Zealand. And so some have been supported indirectly because the government provided a lot of money to employers who needed money to subsidize the wages of staff, some of whom were migrant workers. Some were able to enjoy the benefits of having rent increases freezed and so on for the time being. But were they to completely lose their jobs and have no other form of income, at the moment, legally, they don't have access to unemployment benefits in New Zealand. So New Zealand just recently passed or delivered a budget, huge budget, just a few days ago, with many billions of dollars more than usual to spend on New Zealand's recovery from COVID-19. And there were people calling for there to be a provision in the budget for migrants to be covered under this budget somehow, for social services to be extended to them. And that provision did not appear in the budget, which was quite controversial. And then our Deputy Prime Minister, Winston Peters, who's also our Minister of Foreign Affairs, was interviewed just a few days ago. And he said something like, migrant workers should go home. They should leave New Zealand. We're a small country. New Zealand taxpayers cannot support all of these migrant workers. they should have left when they had the opportunity to do so. Those comments were enormously controversial and have received a lot of attention in the media. So I think that the situation of migrant workers in the short to medium term is something that will need to be addressed and will probably be in the news cycle for a few more days or weeks to come.
Thank you, Albert. Sue, do you have any other receive any question? Or if not, I think we can move to next agenda.
We did have one last question. I think we can make this the last. It was specifically for Kingsley. The question was about the accountability body that you mentioned with the various political parties. And they wanted to know how effective is this body, and are you aware of other states which are usually utilizing a similar accountability measure?
Can I also ask one question to Albert as well? You mentioned in your presentation about some legal framework have been newly introduced, especially including the emergency law. So do you see any potential negative implications to the beauties of your country as a good track record of human rights and democracies?
With respect to the first question, and they were both good questions. Well, I'll address the second question first, actually. The country did declare a state of emergency, which enabled it to take on certain powers under the emergency legislation in New Zealand. But to my understanding, it wasn't extensively used. It was mostly other pieces of legislation that were used under the Health Act, and I think it's called the Epidemic Response Act. And that state of emergency didn't involve the government, to my understanding, derogating from its responsibilities as is required under the ICCPR. And that period of emergency has now ended, and we have entered into a transitional phase. Most of the restrictions on human rights, to my understanding, were not done pursuantly to the Emergency Civil Defence Response Act in New Zealand, but was done under other pieces of legislation, in particular the Health Act. Now, under the ICCPR, it is a specific reason why there can be restrictions placed on human rights in response to a public health emergency. The second question, if you could restate, it was to do with the Epidemic Response Committee, I think, wasn't it? Well, the Epidemic Response Committee, has been, I think, a very important part of the government's response to the situation in New Zealand. It essentially acknowledged that whilst we were in this heightened alert situation and there was not the normal sittings of Parliament, there needed to be some mechanism by which there is a scrutiny of the government's actions. And like I said, it had all these powers to send for persons, papers, obtain records. It had 11 members from all the different political parties, including the chair, which was the leader of the opposition. And it was quite active. I think that you could hear recordings of the committee in action if you wanted. Reports were placed on the committee's website. And quite hard, difficult questions were asked of the legal experts, of the New Zealand Police Commissioner, who was interrogated at one point, Ashley Bloomfield, who's the chief public health official in New Zealand. They were really interrogated. Are these measures necessary? Do you have a legal basis for this? And so on. So I think it was actually an excellent model for countries operating in these extraordinary times. Now, whether or not that model was adopted in other countries, I'm not sure. I know that we were recommending that other countries adopt a similar model to ensure that there are some checks and balances placed on governments during this time when they have extra powers, extraordinary powers than they normally have, together with less scrutiny because maybe Parliament isn't sitting. And I know, for example, that at one point Australia was looking at this committee as a model for them, but I'm not entirely sure from the news more recently, and I haven't followed Australia as closely, whether they actually ended up adopting such a committee. But it's certainly something that we would recommend: more scrutiny, more oversight during times of emergency when governments have more powers and they are subject to fewer checks and balances than is normally the case.
Saru, and you're on mute.
All right, thank you so much for the speaker for sharing your answer to the question from our beloved participants. I think now we can move to next agenda is about conclusion and closing. So I will not summarize our discussion, but Ichel, our Secretary General of ADN, will make a closing remark. So Ichel, are you ready?
Yeah. Yeah, thank you, sir.
So as long as you.
Yeah, thank you, Sharon, for excellent moderators, and thank you for Yahweh, for Yunji Lee, Kingsley, Kaustov, and Sue, who's moderating and facilitating, organizing, and also giving your very brilliant thoughts about this. So, of course, this is very rich discussion, especially representing three successful COVID-19 handle plus 1.3 billion population of India to play as discussion. It is posing very complicated postures of the COVID-19s that apply in different countries. I think the current pandemic represents a formidable global challenges to democracy. The one that been highlighted by the Secretary General of the UN United Nations, Antonio Guterres, the things that starting as a health crisis, but could be gradually changed to the economic, political, and then obviously can also affect the human right and democracy. We realize the response each country will be likely different, where every response can really reflect the efficiency of the governments. It is quite well highlighted by Kostov. Maybe in Taiwan's, in Korea and New Zealand's population is matters. And then the democracy institutionalization is very critical, where actually in many countries in Asia who are claim themselves as democratic countries, not yet able to institutionalizing the democratic principle, value, and as well as practices in the local levels. I think this is the first reflection that we have to do. The second reflection that we have to also consider is ability of the governments in order to impose the policy, providing financial support, including coordinations, and then including the intervention of the civil societies. And that's only can be happen in democratic country, while in non-democratic country, normally the engagement of societies, transparency of media, rule of law, everything is actually no certainties, no guarantees. So what we're going to do right now, what we have to do right now, Taiwan, South Korea, New Zealand can be projected as a good examples. I think this is all our roles as Democrats, advocates, to really keeping ourselves trusted to the democratic mechanism is as the best option right now to handle pandemics. We all have to prove with evidence and narrative. If democracy is not just cherished ideal, it is a system of government best suited to addressing a crisis in this magnitudes and complexity of COVID-19. I think we have to show to the society, do not fall to the authoritarian propaganda, control the situation, control this, stopping that, arrest people. This is the propaganda that we have to keep challenging. In democratic governments, the open engagement between government and society should be should be becoming the vital assets in combating the pandemic. And they are all a key element of liberal democracy. Only in democracy, free media can play the roles of informing people so that they can make sound decisions, scrutinize government and public institutions, and counter disinformation. Rule of law can protect individual liberties from state intrusion and constraints well beyond. But we have to believe the greatest strength of democracy is its capacity for self-correction. So I think we should embrace and we should tell all our governments or our friends who are thinking to taking authoritarianism measure is much better to contain the COVID, show all these facts. So again, I would like to thank participants, not only speakers. I saw many persons whom we all know from the ASEAN Independent of Human Rights Commissioners. I saw a few friends from election commissions, senior our friends. I think many of the groups that we are trying to keep enlarge this kind of discussions because we need to keep expanding. We need to utilize this kind of space to gather, to exchange, to learn each other, and also to consolidating. Post-COVID is very critical, where we realize we heard many democracy system is now is in under pressures. I think all civil society, we need to learn each other and we need to preparing the post COVID-19 scenario. So ADN will continue to have this kind of webinar or web discussions through different channels, and we will engage with different partners. For the next, ADN will collaborate with PRIA, International Academy, or PIA, to jointly organizing webinar with the topic, the role of South Asia civil society in the time of COVID-19 pandemic, on 22nd of May, starting from 10:30 until finish of Indian times. So next, we're going to learn about South Asian civil society situations. I also apologize for those who are addressing particular question like election in Korea. We hope we can come back and organize a special talk about election in Korea with the relevant stakeholders, which is National Election Commission of India. All right, again, thank you so much, and then keep in touch. For those who are still not respond, I think you can asking us if you have particular question to special speakers. Please emailing us. We will be able to reconnect to connecting you to the particular speakers. For the people who asking for the records, I think ADN will soon post the records on our website after editing, of course. And then for those who are asking the presentation PowerPoint, of course, we have to ask the owners, if the owners don't mind to share, and then you will get it very soon. All right, Sarun, thank you so much. And I return back to you.
Thank you. Yeah, thank you so much, HL. And on behalf of the organizer, I also would like to express sincere thanks to our esteemed speakers and also participant for your valuable times and also inputs for and presentation to this webinars. So I hope you all staying in good health, and also we together can fight COVID-19 successfully, not only for our individual country, but also for the world together. So I think our session can come to the end now. Okay, so thank you, Sue.
Thank you. Bye bye.
Thank you. Bye.
Bye.